I do represent Thailand Industrial Hemp Trade Association. I also run a company called WCBD here in Thailand. Given we have half an hour, I really don't know how much I really can talk about the Thailand operating model. But what I'll do is I'll try to go through the slide as quickly as I could. You guys try to pick up what you can. Save your questions and then we can talk about it later. Is that okay with everyone? So I think there's been many talk about, how things get legalized here, or, whether or not it is really legal. How come we see so many dispensary shops? Is it really legal? What can you sell? What can't you sell? So cannabis has been somewhat unlocked about 4 years ago. You can start with the R&D, and the government will always say that, look, we're all supportive about medical cannabis and medical hemp and industrial hemp. Then got to about 2 years ago, then people and private companies can really start applying for licenses. But they started off with hemp. What they did do was they went through the whole narcotics code, got the law all sorted, organized. Then they came up with the draft Cannabis Act, which still not yet approved. So it is not in play. So legally, all these dispensary shops, they actually have to have doctors or physicians or Thai apply traditional doctor with actual license to really disperse those cannabis to people. So you cannot just go around just sell it to anyone legally. Kratom, some of you may know about it, got through okay. Kratom Act is now in play. And we will leave the political discussion some other time when we have more time. That's the narcotic schedule. So it was all in Schedule 5. Now the only thing left in Schedule 5 was opium. This is the highlight of legalization. Things you can do, things you cannot do. It is now, cannabis itself, a controlled herb by Ministry of Public Health. And there are certain sets of rules that you must follow in terms of dealing and handling all these things. There used to be tons of licenses that you must get from different various parts of Ministry of Public Health. The one in light green is the one currently you must have if you're operating. During my time, when I first started it, a few years ago, you actually have to get all of this, which wasn't fun, I can tell you. At the moment, since the 9th of June last year, as they would call it, liberalization of cannabis in Thailand. So it is no longer narcotic Schedule 5, but you still need an act on, just like Kratom. At the moment, it still hasn't passed the parliament for many, many obvious reasons. But what you can do is you have to go and follow ministerial notification. Can you actually register CBD products or medical cannabis products? Yes, you can. There's certain sets of rules you follow. And people had been doing it successfully. I personally had done it for 20 odd products. So there's certain guidelines you must follow with various different parts of FDA. If you do that, then you're fine. And, many things you could do. Anything from food supplement, herbal-based medicine, cosmeceutical, cosmetics, cream, tea, food, novel food. Level of accessibility, that's where Thailand is today. And I hope this become clearer in the coming months, since we will have an election soon. I do get a lot of requests and questions from our neighboring countries, all in ASEAN, asking about how to get this done, and they're mostly from government agencies. This is what I recommend. You do it in phasing. The things you could learn from us, Thailand, the do's and don'ts, and there are things that you should follow, and there are certain things you shouldn't follow. Gonna skip this one. I think you know the difference between the two quite well. Industrial hemp, something that is coming up, and it's been a focus for many conglomerates in Thailand and in Asia. Everyone now has to talk about environmental social governance, ESG, the carbon credit side, the lowering temperature, the hemp battery, the upcoming shortage of lithium. Hemp has an answer. Especially, when we talk about, CO2, carbon credit, which has become a real activities in Thailand. People do actually trade carbon credit here, conglomerates. So it had become a serious matter. And I will save this for some other time, but some of you may know, I'm not sure how many industrial hemp players are there here, but a lot you could do. The association, in conjunction with Queen Sirikit National Convention Center and a few other organizations, we did the first ever Asia Hemp Expo last year. That was about 2 months ago. Over 10,000 people came. If we have time, I would show you the video. But since you're here to learn a little bit more about the industry, the cannabis industry and the hemp industry in Asia, you should know where the industry is headed. So it's not just about healthcare, it's not just about medical cannabis. Recreational side, I will tell you now, has a limited part. Just because currently the act hasn't passed, doesn't mean that it would have a great future. So do think twice before you start investing in all these dispensaries and try to focus on the real recreational side. During that expo, there are many, not only cultural aspect, but the industrial aspect. So this will become just as big, if not going to be bigger, than the actual healthcare. I think you guys know about this better than I do. It's becoming real. People are becoming very active. What you will see in the next couple of years, you're going to see various parts of Asia opening up. Malaysia already has a plan. They already know what to do, what not to do. The Indonesians are just right around the corner. Philippines, I heard, are very serious about getting this done. We've been talking to a few agencies. Cambodia, Vietnam will follow Thailand. Myanmar, I don't know. Japan is doing this pretty soon, hopefully in a few months. Korea would likely to follow. So Asia is now becoming a serious place to get business done. Especially, I heard of many conglomerates, large universities from the Western world had now relocated their R&D center here. The big pharmas, the power of all this, the powerful healthcare guys had relocated their R&D to Thailand, and more will do so. So this side of the world has something to offer, not only just medical cannabis, so you're talking real medical hub here. And it's not just talking about medical services, you're talking, the product hub, the wellness hub, the academic hub. Thailand alone spent close to 15 billion US dollars. last year, just on healthcare. That's a lot. Okay. The sleep disorder market alone is about $1 billion US here. That's how much people take Xanax every year. We have about 19 million people with sleep disorder alone in Thailand. 19 out of 68 million. That's a huge number. Oh, sorry, there's one particular number I'd like to show you. On the bottom right, almost 10% of our adult population has NCD, non-communicable disease. Diseases that we created on our own. Diabetic condition, hypertension, obesity. This part of the world, this number of NCDs will keep growing. And as we had become age society already, this is a serious matter. And cannabis will have a great future if you really focus on healthcare and science. Medical tourism here is extremely competitive. The service is good. Our doctors are good. Our services are good. And our hospitals are very, very good. And the cost is extremely competitive. I'll talk a little bit about the opportunity, the Hemp Hub of Asia. Thailand Ministry of Industry had already put together and had been approved by the cabinet already, the 5-year plan starting this year of the commercialization of hemp in the Thai market. And they already have the blueprint on becoming the regional leader. The opportunity is real. This is the country with 40 to 50 million tourists every year. Everyone came here and want to try them. Quality, though, on the other hand, remains concern to me. We have all types of growers in this country, and trust me, we don't know this well because it's been prohibited for so long. Where you're gonna get your skills and science and the techniques? The whole industry had been relying on underground growers for their technical expertise, and some do work and some don't. That's the potential I was talking about. The number is real. The power had shifted from west to east in many aspects. The populations are growing with China, with India, with ASEAN coming together, and people do travel. The medical industry that used to be a few decades ago is no longer the same. People do talk and do follow preventive more than curative. People do go for nutraceutical rather than pharmaceuticals. People don't like getting their kidney cleaned every week after taking certain medicine for 20 years. I think all of this adds up to real opportunities in this part of the world. Becoming this industry, these services have becoming more personalized. You don't just go to doctors without doing your homework first. Now you have doctors and specialists for everything. You don't just go to one particular physician and just say, okay, I have this problem, what do I do? I mean, that industry had evolved a lot. So I'm talking healthcare, I'm talking nutraceuticals, I'm talking supplements, I'm talking preventive. Okay, so I promised this slide. The actual operating model. How much time do I have? The successful operating model, in my belief, for Thai players is to not just copy the Western model, because there is no way we could compete with people who had been doing this 3-4 decades before us. I think the secret is in combining beauty of East and West together. But you really have to be professional and truthful to your profession. Don't take shortcuts. And that lots of people love taking shortcuts because it gets them faster results. In reality, you need your science, you need your R&D. There are many ways that, this side of the world, we are more familiar with herbal formulations, herbal extraction. We could potentially make better cannabis-related formulation for treatment. So I'm not just talking about the CBG, the CBN, the CBD, and Delta 9, Delta 8, and try to play around with terpenes no more. I'm talking about curcuminoid, piperine, germanium, working in formulation that actually could treat people with real clinical trial. So without all those, you're just going to get hearsay. So the operating model is where you actually have integrated platform from cultivation, extraction, R&D, products, marketing. So in the end, your customers, your patients, they all want good quality, reliable products that aren't so many in the market today. The formulated product services, I was talking about the healthcare services in Thailand. This is where we have competitive advantage. We do combine the beauty of East and West together, not just services but also in products. The Asian herbs problem in the past had always been about standardization. You need to actually have science behind it. And I talked to you about medical tourism before. This is a real opportunity. So I'm not here to advertise Thailand is such a great place to get business done. I'm here to talk to you about what opportunities are there available in this market, and how we could potentially work together. I think we should go for a win-win solution. Not always work, but it's a good place to start. And look, the actual numbers of the Thai FDA product approved so far, close to 1,000. This was the official numbers from last year. I've just checked again yesterday. That number is about 1,000 products that have already been approved, cannabis related. I will mention pet care. So they are also allowing CBD currently for external use, topical use, for cats and dogs, and other animals. Let me remind you, they do not work on all animals. Only animals with endocannabinoid system. Okay, we'll get to that when we have more time. It's a big market. Thailand do export over 3 billion to 4 billion, about 3.5 billion of just pet food overseas every year. I think this is a market where you actually can make real money. But again, to get the product registered, you need your science. So don't just grow them and putting things together and just sell them. It doesn't work that way. They do work on normal pain points of all these animals. I will focus on cats and dogs first. They do have endocannabinoid system. They do age. They do get mobility problems. They do have anxiety the same way that we do. Actually, more so on dogs, especially separation anxiety. And they do have problem with a lot of information and skin treatments because they do fight with other dogs. So far there's been products out already. It's a huge opportunity if you're looking into it. This is also a good place to start. I will talk about my company for just 2 minutes. Dr. CBD, the way we design ourselves, we want and we aim, and we got our 2 phases done already, which is just be a complete and integrated platform. We aim for nothing else. We don't want to be known as the best cultivators in the country, nor do we want to be the best extractors in the country, but we do actually have real science, real people, and more importantly is the way we structured ourselves. We started with R&D and license acquisition. The R&D work began about 4.5 years ago, coming to 5 now, with only one aim. We want to get good quality FDA approved products out. And they had to be different. So it won't be a copycat of what got done in US or in European continent. It will be something different and focus on real pain point. We do only have 3 codes of conduct: safety and non-toxicity, consistency, and efficacy. It's a team of about 100 people, half of which are scientists, anything ranging from botanists, pharmacologists, doctors, all the way to zoologists. I don't think it is for everyone, but I got asked to talk about operating model. This is my operating model. The cultivation, the indoor cultivation, and the supercritical CO2 extraction is something I have to do myself because I really don't trust anyone in this business. We actually we sell no primary products. We don't sell flowers, nor do we buy them. We grow for our own use. We rarely sell our extracts. We do provide them to all the leading universities and major labs and Ministry of Public Health though. But our real focus is on the end products. Anything ranging from herbal-based medicine, which is what you are allowed to register them as, all the way to cosmeceuticals. If we have time, I will play a little bit of video, but I'll see how many questions we get. Oh, and we also do provide healthcare services through our clinics, which is a department, a medical cannabis department inside a hospital called Unveiled, and we're opening one in Thong Lo. End of next month, I think. And we also have another one in Hua Hin. And we do supply, we do OEM, we do white labeling for most of the clinics in Thailand. Everyone wants brands, everyone wants products. They not necessary, did not pre-plan or invest in science, especially R&D. And this is where we come in. When we have time, some other time, I will talk about industrial hemp, which is a big market and big opportunity. And this is our operating model, a full integrated platform, all in Sukhumvit 103, which is not far from here. The cultivation, the indoor cultivation, the extraction, the R&D, the science, and the people are all there. Don't have to travel. Okay, I will pause here. I think my time is up.